Hi, I'm Sarah Makarek, and I will be discussing critical social theory today. So this is for Nurse 602, and this is my theory analysis presentation. So to start off, what is critical social theory? I found through my research that there were three key points sort of addressing this idea. And the first one, the aim is to sort of critique and transform society as a whole. The second one, more specifically, it finds the underlying assumptions and conditions that are at the foundation of society, and it identifies the circumstances that marginalize human beings. So, sort of finding the underlying assumptions in society that prevent people from truly understanding how the world works. Another key concept is that it challenges the power structures and institutional systems that people are a part of. Now, in terms of the scope and level of the theory, since this theory offers a pretty broad framework for addressing complex ideas and concepts, I've categorized it as a grand theory. It provides good insight specifically to the nursing practice, but it is hard to provide empirical data when applying this theory. So, in terms of the origin of the theory, there are two sort of broad traditions that have stemmed from this theory. The first one being in European origin. The Frankfurt Institute of Social Research was established in 1923, and Max Horkheimer sort of became the pioneer and of this theory. He became influential in his reinterpretation and critique of Marxism. And there was another theorist, Paul Freire, and he became widely known for his application into education and specifically into progressive education. And another sort of key concept that originated from this theory was that social justice lies at the heart of critical social theory. An important quote from Horkheimer was that he stated that critical social theory seeks to liberate human beings from the circumstances that enslave them. So Horkheimer really examined and analyzed sort of the conditions that human beings are enslaved by, whether that being race, whether that being their socioeconomic status, their gender, their age, sort of all of these theoretical concepts that sort of bind us to an assumption or a condition that will prevent us from truly understanding the larger part of society. So, in the context that this specific theory is described, it can sort of be applied to all these sort of examples in different settings, such as in terms of nursing in the hospital setting and any healthcare setting, it can be applied to that. In certain situations, specific situations in nursing, for example, at the bedside, in bedside nursing, when we apply our patient care to a patient of a different gender or different race, we can apply sort of this theory into our nursing practice. And in general, we can use it when discussing certain populations in society, such as people of color or women, or sort of populations that have been marginalized, and sort of apply that there. So, when analyzing this theory, Bowman identified three criteria um, to adequately define this theory. The first one being explanatory. So, the theory, when applied, has to explain what is wrong with the current social reality. And for example, critical race theory is a sort of theory that discusses race within a society and um, how laws, social and political movements, the media are all shaped by our societal conceptions of race and ethnicity. The theory has to be normative and practical in that it has to provide both clear norms for criticism and achievable practical goals for social transformation, as well as identifying the factors to change it. So, when analyzing this theory, it's pretty theoretically defined and operationally defined when you apply it to a specific setting, situation, or population. Although it does not provide any obvious linkages to these settings, situations, or populations. It's sort of a broader perspective that you can apply it to. There is no universal model or diagram that even Horkheimer developed or designed at the time to sort of apply this theory. And although it discusses the outcome of freeing people from the circumstances that enslave them, there's no clear or concise outcome of what that truly looks like in each population settings or situation. So, when evaluating this theory, it loosely fits with the current nursing standards and interventions of modern society. This theory is relevant socially and across different culture settings and can be used in a lot of postmodernism theories such as feminism, critical race theory, as I've mentioned before, and post-colonial criticism. In relation to nursing practice, critical social theory is really evident when discussing health disparities and health inequity. When talking about people of lower income who don't have access to healthcare, people of color who have been affected by the COVID-19 pandemic, and to really talking about the equality and access to healthcare and the institutions and our healthcare systems that prevent us from all having the same amount of healthcare. So the first application for this theory, I found a research article discussing critical social theory as a framework for epilepsy services. The researchers used the educational framework within epilepsy services by first integrating the principles of the theory into the curriculum for healthcare undergraduate education. And then they followed them at a postgraduate specialist level and really dived into the greater depth of understanding of its principles and how the theory should be utilized in practice. So the researchers found that using the educational framework of critical social theory, they have a great potential to empower people with epilepsy in their day-to-day lives and their engagement with clinical and social services. The second research article that I found was its application in an education setting. So this described the experiences and perceptions of graduate students using critical race theory as a theoretical framework for their master in social work education program. So the students in this program used critical race theory, which is an extension of critical social theory, and applied it as a theoretical framework in their study. The findings revealed that there were large gaps between the theory itself and real life applications to reduce racism, marginalization, and oppression. And the findings ultimately stated that more research is needed to clarify, refine, and expand critical race theory into actual real life practice, which sort of highlights the limits of this theory. The third article I found was Critical Social Theory in a Research Setting. And this one discussed critical social theory as a framework for dealing with ethical issues of disclosing incidental findings in genomic research. So, the importance of genomic research is really important today in identifying opportunities to improve health, prevent disease, and ultimately treat populations as a whole. And when incidental findings of genomic research are uncovered by a researcher, there can be significant ethical implications with disclosing these findings to research participants. So the researchers discussed that the principles of autonomy, beneficence, and maleficence, which are also nursing theories at our core, must be considered when addressing the disclosure of incidental findings from genomic research. They ultimately discuss critical social theory as a framework to achieve a balance between the best interests of the individual versus society and the ethical decisions that follow. These are my references for my theory analysis, and thank you.